Good morning, and thank you very much for having me here today, and thank you for having me back as well. So my name is Chris Evans. I am the founder of Little Journey. By background, I'm an anaesthetist and a researcher looking into children's anxiety before a healthcare procedure. Next slide, please. So we know from the research that about 75% of children experience significant anxiety on the day of a procedure. And this anxiety is associated with worse physical and mental outcomes, whether it's the need for physical restraint, pre-medication, unplanned admission to hospital. And all of that has an impact on the family, but also has an impact financially to the organisation as well and to society as a whole. One of the biggest things for me was that 50% of children experience negative behavioural changes after an operation at 2 weeks. Things like bedwetting, separation anxiety, nightmares, and it's ongoing in about 8% at 1 year after procedure. And we know that psychological preparation and support can enhance this and reduce it, but sadly it's often very costly to perform and quite time consuming for staff. Next slide, please. With the pandemic, this has sort of really been heightened as actually we now have sort of an increased baseline fear of hospital with PPE and coronavirus swab testing that's occurring. And actually the pre-assessment and the preparation support that's provided is typically now tailored towards the parents with that reduction in sort of face-to-face interactions. Next slide, please. Now, Little Journey has been something that has evolved over a number of years based off my clinical experience, my research, and also as a parent having a child undergo surgery. I was actually tricked into doing a PhD about 5 years ago, and we started off using doing some literature searches, systematic reviews. We then held lots of key stakeholder interviews with both parents, children, and staff. And then from that, co-created scripts to help support families through that journey. We then took all of that to the NIHR Young Persons Advisory Groups and did a usability and acceptability assessment of a prototype version of the application before going on and doing a formal study at UCLH in this. Following that, we actually went on to perform a multi-centre randomised control trial, which is still ongoing at the moment in 10 NHS organisations. But while we were doing this, we had a lot of sites who actually said, we want to get up and running and going and using it. And so we've introduced it into standard care in 43 NHS trusts now. And from that, we've actually done a health economic analysis showing both benefit to anxiety, but also benefit to financially to the organisation. During the pandemic, we've had a bit of a internal reflection and then working with some of our early adopting sites to perform research into so actually what sites want moving forward. And we're just launching a new platform now to help support that. Next slide, please. So the actual solution that we've created is a mobile application that helps support and prepare families in the comfort and safety of their own home. So by supporting families remotely, what we're able to do is actually try and reduce those inequalities and that regional variation, as well as improving access to the care. We have a number of sort of different components of the solution, from virtual reality tours, therapeutic and relaxation exercises and games, as well as having parent information content that's drip fed over both pre and post procedure. Sitting behind all of this is actually a system for organisations to go through and to control the content in real time, updating it as and when is needed. So if something changes because of the pandemic, you can update that automatically in the system, and that information cascades down to the patients. Next slide, please. So what we have here is actually a video of the web portal system that we've developed. And what we can do is we can add in trusts, the hospital within that trust, and then we can add in pathways specific to that hospital. We have animation sets for ambulatory surgery, and we're just launching some new ones for endoscopy, phlebotomy, coronavirus swab testing, and also moving towards clinical trials. The first thing we want people to do is actually add in their team members and make this very much a sort of multidisciplinary approach to the content creation. And then we can have organisations set up their own pathway and do that configuration. So on the left-hand side of the screen, you'll see the actual preview of the app, what families see, and on the right side is what you as an organisation can do in order to control that content. So we can create these virtual tours that take children from arriving in hospital to going home. You can create the different rooms that they'll go through, add in 360 images, and then what we can do in those images is actually implant animations and storylines. We have animation sets for children aged 3 to 7 and 8 to 12. We can select whether staff are wearing PPE or not. And you can put in the character relevant to that room and what families, who they'll meet on the day. And then we have a variation in the storylines that we've created to try and reflect the variation in practice that occurs, whether it's having one wristband or two wristband, the children wearing a gown or not wearing a gown. So it means we get really sort of detailed content specific to that local organisation's pathway. Now, the actual tours can be viewed on an iPhone, an iPad, or in a virtual reality headset. And from the research that we've done, we've found that actually younger children like using it in the phone and the iPad, and the older children like doing it in the VR headset. Some of the research we found is actually that parents are the gatekeepers of information, and we needed to engage families and the parents in the process in order to better support the child. And so what we created was a parent information section that did a number of different elements, from drip feeding information, providing checklists, key hospital information, fasting guidelines. The information articles that we provide are drip fed both pre and post procedure. And the organisation, we create template versions, but you can go through and actually take our templates, edit them, amend them, selecting when they're delivered to what age groups, and marking an article as important, which means it gets sent as a push notification, so we can try and modify families' behaviours and actions. Our checklists, again, are all for both the child and the parent, and can be accessed according to different age groups. And the key hospital information is delivered based off, again, local preferences for who you want people to call in different scenarios and when you want that to happen. We've created these fasting guidelines select solutions. So actually what we can do is rapidly update fasting guidelines based off local policies, and based off the time of the date of arrival in that the family put in. It then sort of triggers and notifies and nudges them when certain things can and can't be drunk or eaten. Next slide, please. Our virtual tours have been co-created with families as well as healthcare professionals. And what we can do, and you can see the difference between the 3 to 7 and the 8 to 12-year-old animation sets that we've created, is the 3 to 7-year-old, they undergo they follow a third-person tour, so a little alley going through for surgery, and it plays out of scene to sort of reduce distraction, whereas in the older children, the animations play in scene, and they follow a first-person storyline. Next slide, please. It's not just all about a smartphone app, though. We've also created information leaflets that have sort of multi-layers to them. So you can scan QR codes which link to YouTube videos. This is our some YouTube coronavirus explainer videos we made for children earlier this year with NHS England and NHS Test and Trace, and they've had over 270,000 views now. Next slide, please. We've been launched in lots of organisations around the UK, and we've got a lot more in the pipeline. And the next slide. And we've had fantastic feedback from families, from parents, from healthcare professionals, and in total now we have a 4.7 App Store rating from 470 reviews now. Next slide, please. We've introduced Little Journey into a number of sites and then performed analysis looking at sort of different components. This was a study at South East Hospital, and we found that 71% of patients who were verbally offered the application went on to download it and use it, and that led to a 30% reduction in recovery time after surgery, an improvement in fasting times, and a reduction in on-the-day cancellations as well, leading to benefits to both the hospital and to society, never mind the sort of the patient experience improvements. Next slide, please. Sorry, I'm not sure what's going on with the slides, but this is a slide which is explaining about a QI project that was done at the Royal Belfast Children's Hospital. And what we found was that this was led to a 30% reduction in anxiety in children with autism and ADHD. Next slide, please. We're expanding not just for ambulatory surgery, and we're now moving to coronavirus swab testing, endoscopy, phlebotomy, clinical trials. We've just put some bids in for an MRI solution as well. Final slide. So we're now looking at how we can address health inequalities, looking to create a hospital passport system, and to provide a much more personalised solution based off the end user's behaviours. So thank you very much. My email's at the bottom there.